What is diabetes? What are the differences between type 1 and type 2 diabetes? What is diabetes? Diabetes is a chronic condition that affects how the body uses glucose, sugar, present in the blood. Normally, the body breaks down food into glucose, which is then utilized as energy by cells with the assistance of insulin, a hormone produced by the pancreas. However, in individuals with diabetes, the body struggles to process glucose adequately due to issues in insulin production or action. This leads to elevated blood glucose levels, potentially causing serious long-term complications affecting organs such as the eyes, kidneys, heart, nerves, among others. Types of diabetes. There are different types of diabetes, with the main ones being type 1 and type 2. Type 1 diabetes. Type 1 diabetes is an autoimmune condition where the immune system attacks and destroys the beta cells of the pancreas responsible for insulin production. Without sufficient insulin, the body can't regulate blood glucose levels. This type of diabetes usually develops in childhood or adolescence, although it can occur at any age. People with type 1 diabetes require injectable insulin to survive since the body doesn't produce this hormone. Type 2 diabetes. Type 2 diabetes is more common and typically develops over time, mostly affecting adults, although it's becoming more frequent in children due to factors like obesity and a sedentary lifestyle. In this type of diabetes, the body produces insulin, but either not enough or the cells don't respond correctly to insulin resistance. Lifestyle changes, diet, physical exercise, and sometimes medications are frequently used in treating type 2 diabetes. Differences between type 1 and type 2 diabetes. Cause. Type 1, caused by the destruction of beta cells in the pancreas due to an autoimmune reaction. Type 2, generally associated with genetic factors and lifestyle, such as obesity, lack of exercise, and inadequate diet. Insulin production. Type 1, little or no insulin production by the pancreas. Type 2, insufficient insulin production or resistance to insulin action. Treatments. Type 1, dependence on injectable insulin to regulate blood glucose levels. Type 2, initially focused on lifestyle changes, healthy diet, physical exercise, and in some cases, oral medications and/or insulin. Both types of diabetes require constant monitoring of blood glucose levels and regular medical care to prevent complications. It's important to note that diabetes is a serious condition, but with proper care, including a balanced diet, regular exercise, medications, if necessary, and medical supervision, it's possible to live well and manage the disease. I'll leave here a recommendation for a supplement that has been helping many people effectively manage diabetes, called Glucoberry. Glucoberry is a product designed for diabetes control. Glucoberry works because it contains an exclusive ingredient, maqui berry, which effectively controls diabetes. I can confidently say that Glucoberry works because one of its main ingredients is maqui berry, an exclusive ingredient for diabetes control. Unlike any other diabetes controller, Glucoberry not only controls insulin but also manages sugar drainage. When insulin supplies excess sugar to the sugar drain in the blood, it creates a blockage of the gray protein that hinders sugar drainage. When excess sugar cannot be drained, it goes back into the bloodstream. Glucoberry provides unique support for blood sugar drainage. Unclog this drain. Only Glucoberry's exclusive formula, developed by doctors, helps against blockages in blood sugar drainage. It helps your body eliminate excess sugar. There's nothing like it. It's important to note that Glucoberry is not sold on other websites besides the official site. To assist you, I've left the link to the official website below.